An email doesn't need to include diagnosis, treatment details, or clinical notes to contain protected health information or PHI. In fact, some of the most ordinary emails you send in your practice may contain PHI. I'm Annabelle from Hushmail, and in this video, I'm going to give you 3 questions you can use to recognize PHI in everyday email communication. But what is PHI? Let's look at the formal definition. PHI is any information that identifies a person or could be used to identify them, relates to their past, present, or future health, healthcare services, or payment for healthcare, and is held or transmitted by a covered entity or business associate. You don't have to learn the formal definition. A simple way to check is to ask yourself 3 questions. 1. Can the person be identified? 2. Does their information relate to their care? And 3. Are you holding that information as your role as a healthcare provider? If the answer to all 3 questions is yes, then it should be treated as PHI. Let's put that into practice. Consider these 3 emails you might send during an ordinary day. Can we move your appointment to Monday? I received your intake form. Your receipt is attached. None of these messages include diagnosis or clinical details, but all 3 have an identifiable recipient. They are related to their healthcare or payment for healthcare, and you are holding it in your role as a healthcare provider. And that means it should be treated as PHI. These emails are easy to overlook because they don't feel especially sensitive. But PHI is not determined by how sensitive it feels. What matters is that they connect an identifiable recipient with receiving healthcare services from you. So before you send your next email, pause and ask, can the person be identified? Is it related to healthcare? Am I handling it as a healthcare provider? Once you recognize PHI is involved, it becomes much easier to decide when to use a secure HIPAA-compliant way to communicate.